Hello, everyone. Welcome to our webinar on introducing planetary health and well-being in the face of humanitarian crisis. This is organized by SCPH in collaboration with the Center for Research and Wellness at Shanghai University. Thank you so much for taking the time to join us at this webinar session today. This webinar is going to be recorded and streamed to our Facebook page at the Sunway Center for Planetary Health. So in case you miss anything or in case your friends would like to watch this webinar afterwards, please feel free to check out our Facebook page to find a copy of this after this webinar. So to start things off, just an short introduction about who we are here at the center, as well as our collaborators, before I pass things on to the moderators to get things started. So my name is TJ. I'm the Program Officer from the Sunway Center for Planetary Health, and I'm very happy to be here with all of you. The Sunway Center for Planetary Health is based at Sunway University in Malaysia, one of the fastest growing and most innovative universities in the world. Through the center, Sunway University supports this commitment to planetary health through education, research, making knowledge accessible, and engaging with people across the Asia and Pacific regions. Under the leadership of our Executive Director, the renowned humanitarian Professor Tan Sri Dr. Jamila Mahmud, the center leverages the diverse capacities of the university's existing faculties and networks, and is forging new connections with partners from the region and around the world with 4 key focus areas. Firstly, preventing the next pandemic. Secondly, tackling the climate emergency. Thirdly, creating healthy cities. Fourthly, and finally, achieving healthy food systems. SCPH will be the proud host of the 2024 Planetary Health Summit and 6th Annual Meeting, a global multi-stakeholder conference with the theme of From Evidence to Action, Confronting Reality. My colleague will leave a link to this event in the chat. Please click on it to find out more about this summit. Here at the center, we're very happy to be collaborating with Shanghai University to host this webinar for you. So introducing our collaborators. Established in 2023 as part of the College of Liberal Arts of Shanghai University, China, the Research Center for Health and Wellbeing aspires to collaborate with higher education institutes in China, globally, as well as United Nations agencies. The Research Center aims to combine ancient wisdom with contemporary knowledge to foster new understandings and refresh perspectives of key issues related to global health, social healing, and well-being of the Earth, and allow those understandings to shape future policy and practice. The Research Center attempts to bring an all-inclusive worldview to understand the contemporary challenges to global health, social healing, and well-being of the Earth. So I'm very happy to pass it over to our moderator, Dr. Arnab Chakraborty. He is currently working as a research fellow at Shanghai University, College of Liberal Arts, after completing his PhD from the University of York in the UK. His doctorate, funded by the Wellcome Trust, was on medical services in colonial India. Arnab also serves as the assistant editor of the journal Medical History, Cambridge University Press. His broader research interests are in global health, history of medicine, and health, environment, and diseases. He has experience of working with several health organizations, including the WHO, Fiocruz based in Brazil, and the Public Health of England. You have the floor, Dr. Arnab.
Thank you very much, TJ. Welcome, everyone. I'm very happy to be here. And I'll take a little bit of few minutes to introduce our first speaker for the day. We have a very exciting line of speakers for today, so I'll not take too much time and I'll just go right to it. So our first speaker for the day is Dr. Maria Guevara, who is a multilingual medical humanitarian specialist with a medical doctor profile, trained in pulmonary critical care and tropical medicine, and a strong background in complex humanitarian settings, global health policy, and advocacy. She has over 18 years of humanitarian experience and over 10 years management practice through her work with Medicines Sans Frontières, which is Doctors Without Borders. Her extensive humanitarian field work has spanned across countries in Africa, Americas, and Asia in both emergency and stable settings, as well as being the organization's regional representative in Asia from 2012 to 2017. She is currently the MSF International Medical Secretary since February 2021. Dr. Guevara is a member of the advisory group to the Shanghai Center on Planetary Health. Her special interests and passions are global health, response in emergencies, and planetary health. She has played an instrumental role in and continues to drive concerns regarding planetary health, climate change, and environmental degradation in MSF and in the health and humanitarian sectors at large. So very much looking forward to her presentation today. Over to you, Dr. Guevara.
Hello, thank you, Arnav, for the introduction. Can you hear me okay? I'm hoping you do. And also thank you to the Shanghai Center for Planetary Health, a dream come true, and Shanghai University for hosting this webinar. We're going to speak professionally on behalf of MSF, and as personally, as someone who's quite passionate about these three intersectional topics of planetary health, humanitarian action, and well-being. I don't have a presentation today, but I'll just speak you through a bit of the why, the how, and the what of these three topics, and I will leave it to my other co-panelists to speak a little bit more on that well-being aspect. My role here is to highlight why planetary health is important for humanitarian action and how we're doing that at MSF and our experience thus far, and what should we be doing next. I just wanted to also say hello to everyone. So good morning, good afternoon, good evening from wherever you may be calling. I'm actually calling you from the south of France because I'm on my holiday, but had been traveling through Asia in these past few weeks. And I can say that these last few days, even though it's near the end of the season of summer, remains quite hot with the temperature still remaining way above average. And it's not a personal sentiment alone, but I know that from data to just this past summer, this, at least according to analysis of the scientists at NASA, Goddard Institute of Space Studies, July 2023 was probably the hottest month in any other month in the global record, and that's that it's massively warmer than any previous Julys and any previous months on record since 1880. And in this last 5 years, since 1880, the Julys have been the hottest over the past few years. Also, the World Meteorological Organization have called the summer of 2023 a summer of extremes, resulting in major damage to people's health and environment. And we've seen these in the news, as we've just seen the ravage of the wildfire ravaging through Greece these past few months, where they declared this the largest wildfire ever recorded in Europe, or in Canada, with the worst wildfire season yet they've ever experienced throughout the different provinces, with at least 1,000 active wildfires occurring at one time in this summer. So these extreme events sadly have led to many lives lost, injuries, caused much injuries and displacements, as well as land degradation. If you put such events on top of ongoing concurrent humanitarian crises, you have a disastrous situation. And what I have in my background, as a virtual background, is an image of our facilities supporting the medical facilities supporting the Sudanese refugees that have just come across the border into Chad. This is also happening this summer, and where the Sudanese have experienced ongoing violence, which erupted this past summer because of intense urban warfare, gunfire, shelling, or airstrikes. They fled to find safer areas across the border, to find food and water because of the severe shortages and lack of access in Sudan. But they're also facing lack of access to medical care, and they have tried to find the peace across the borders. So today there are at least more than 380,000 people that have crossed into Eastern Chad, and where we're trying to support in addressing the injuries they have sustained through this, through the violence, but also seeing significant amounts of numbers of malaria, diarrhea, malnutrition. If you know anything about Chad, there are three different levels of climate stratification. There's a desert in the north, semi-desert in the center, and very tropical in the south. And as through the years, this has gone more extreme, with the north becoming drier and the south becoming wetter. And having served there just a couple of years ago in the midst of COVID, where there was significant measles and malnutrition outbreaks already existing. Imagine when you receive such amounts of refugees and you're already faced with water and food shortages, having to manage on top of that. So this is not the only emergency we're seeing today that's compounded. Diphtheria outbreak is all over the globe today. There's a significant outbreak happening in Nigeria as we speak, with lack of diphtheria antitoxins availability. And there's also the cholera outbreaks that we've seen through this past year, with 30 countries being affected, which I've been heard of for decades. But this is just to highlight how the real compounding impact of climate change and environmental degradation and existing humanitarian crisis today, and that it's really making it much more severe, much more likely, much larger and more complex, and for an medical organization, humanitarian organization like UNICEF, even if we are versed in responding to disasters and emergencies, we are reaching our limits. It is so important that we actually start putting a lens on how do we address better and smarter in a situation of climate crisis. For us, it is the biggest threat and the risk multiplier for the vulnerable populations living in already precarious situations. And we are also cognizant, and this is where planetary health makes sense, is of that responsibility as humans and as humanity to address the plight of humanity, but not in isolation to its natural ecosystem. And this is why it makes sense for MSF to really look at it from the planetary health approach, and why we urge humanitarian actors to also look at the same way. Because it reminds us and reinforces the idea of the crisis at hand, of our inseparability with the health of our planet Earth. It is our life support, and as we take that, we have more emergencies. We cannot address this also in isolation. As we said, we're already reaching our limits. And planetary health approach recognizes that need for radical collaboration across boundaries and borders and across sectors. It also reminds us, as the whole of humanity, the ultimate responsibility that we have in trying to fix the self-destructive decline we've put on our natural ecosystem. And as we approach these planetary boundaries, right, whether that's climate change, land degradation, biodiversity loss, food and water insecurity and such, we are actually causing the global health challenges and humanitarian crisis of today. And we should at least be the ones to find that planetary health solutions. And these are real, true emergencies that we need to address now. And planetary health framing helps. But how do we do that in MSF? How do we translate that on the ground? It's an early road that we're paving amongst many, and still discovering the way. We are approaching this from a three-dimensional or three-pillared approach. At the heart of it is, again, this need to do things much smarter, more climate smart, in fact, to address our social responsibility and to do our part to do no harm to to the environment as well as therefore to the people that we are trying to serve, and to give voice to those witnessing and living this impact on
seem to be facing some technical issues. Let's just give Dr. Maria some time to reconnect.
Can you hear me
Yep, you're back with us.
now?
Yep. Hi, Dr. Maria. We can hear you.
Can someone answer?
Yes,
Yep.
Can you hear me
yes,
now?
we can.
Okay.
Yes,
can hear
yes.
you.
Sorry, I don't know, but oh,
Sorry, it seems there's some technical difficulty she's facing. In the meantime, until she connects back, may I ask everyone, like request everyone, all the participants to post in your questions if you have any, specifically for today's discussion, and we can take those afterwards, after all three speakers have spoken. Thank you. Please wait for a bit, and apologies for the inconvenience.
Okay, it looks like Dr. Maria might be taking some time to reconnect. I think in the meantime, it might be best if we move to the next speaker, Dr. Janaka.
Yes, okay. Yeah, okay. Thank you, TJ. So sorry for the inconvenience. I think there's a issue with the connection. So for our second speaker, we have my colleague at Shanghai University, Professor Janaka Jayavikrama. He's Sri Lankan by birth and disposition. He's a social anthropologist and distinguished professor in the College of Liberal Arts, Shanghai. He's also director of newly established Research Center for Health and Wellbeing here at the university. He's mostly known for his work on concepts of care, health, and well-being related to disasters, conflicts, and uneven development over the past 30 years. Janaka has led and contributed to humanitarian assistance in Asia, Africa, and the Middle East with UN and other international agencies, as well in collaboration crisis-affected communities themselves. During 2014 to 16, Janaka has been an advisor to the United Nations World Humanitarian Summit held in Istanbul, Turkey. He continues to advise the UN and international agencies on humanitarian affairs and development programs. Janaka's research covers a range of fields. He is passionately interested in the question of how lived experiences crisis generate concepts, how we might examine philosophical traditions from Asia, Africa, Latin America, and the Middle East as generative of theoretical and practical approaches to facilitate well-being, how to reduce the gap between human beings and nature, and how the impact of historical processes and events on the present day are joined together in the making of the critical. Thank you. So looking forward to hear from you, Janaka. Stage is yours.
So thank you very much to Sanmay for collaborating with us in this webinar, and we are hoping to have more collaborative activities as we go along. To start with, my perspective here is, so my talk here is to basically give you an idea about the links between health, society, and planet. And when we talk about sustainable development, it talks about the intergenerational equality and inclusion. And in that process, next slide, please. Yeah. In that, we need to understand the current, we don't have a current equality process. We don't achieve the equality and inclusion in current generation. So we are quite hindered to achieve the future equality. In that, the disasters and conflicts are rising, mostly affected the poor people, especially women and children. And also there is a greater inequalities between the rich and poor. If you look at the 2022-23 global wage report by the International Labour Organization, you would see the problem and difference. Next slide, please. So when we look at the world today, work and professions have taken over most lives across the world. Even leisure and fun has to be bought in the market, and it creates inequalities to maintain markets. There are a lot of hidden poor to maintain luxury in big urban centers. One of the outcomes of capital marketplace is to create risks. For example, security, insurance, health, food, transport, education, etc. Are creating systematic risks to people. And also the current marketplace has cannibalized resources, privatization of services such as health and education, and also commodification of resources such as land and water are becoming a bigger problem. Also, it has taken the citizenship away and created consumers. And as consumers, people are competing with each other, and this is a particular type of individualism. Next slide, please. The modern lifestyles are messy and violent. People are commuting and working long hours without economic security, no social protection, no health security, and all the current social conditions create disorientation and make people very, very angry. That's what we are seeing even in smaller countries like Sri Lanka today. It is difficult to cultivate politics of love, but it is easier to cultivate politics of hatred in this situation. Without love for oneself, each other, and for other living and non-living forms, human beings cannot maintain physical, mental, and spiritual health and well-being. And in that, I argue that most societies in the world today are going through a humanitarian catastrophe. Next slide, please. So I want to present a different perspective to this. I would take you back to 600 BC, an Ayurvedic text that talk about what is health. A healthy person as someone whose mind, body, constitution are all in equilibrium. The digestive is in a balanced state. In addition to the body's tissues and waste products being in balance, mental and spiritual well-being is based on the mind, and sense organs are in pleasant state in harmony with nature. When a person is balanced in all of those areas, he or she is considered healthy by our Ayurvedic standards. And as you could see, that instead of trying to dominate nature, we have become subordinates of nature. We are part of nature, natural world. Next slide, please. So to take you a little bit more towards these ancient past wisdoms, what we have seen is that human interactions with nature, all living beings and non-living things, had three distinct elements. There was respect, which is realization that everyone is interlinked. Second one is spiritual, again, not from a religious perspective, but to think beyond the human physical limitations. And also third, experiential, that we were responsible of choices and action. Next slide, please. To give you an example, that half of our breathing apparatus is outside of our bodies. Whatever we exhale, the trees inhale, and whatever the trees exhale, we inhale. In that, I invite you to think about how we are interconnected to everything around us, everything that we do, everything that we create has an impact on everything around us. So in that, what I want you to think about what Maria was explaining earlier about the climate change, the weather patterns, and all the disasters, and even the conflicts today are interlinked to all of us. In that, we all need to take responsibility about what we do. And thank you very much.
Thank you very much, Janaka. Very interesting and important points you raised at the talk. Let's go back. Okay, let's go to Anu, our last final speaker for the day, and maybe we'll go back to hear what Maria has to say afterwards. So for our third speaker, Dr. Anusanthi Pillai. She is a gender specialist and advisor to national and international humanitarian and development sectors. Anu has also worked as an advisor and specialist on addressing violence against women in Southern, East, and West Africa, and spent some time in India working on interfaith conflict. She has been seconded to the United Nations and deployed to the Pacific Islands based in Fiji, Somalia, Nairobi, the Philippines, Afghanistan, Nepal, and Nigeria. She has worked in Iraq as a gender-based violence consultant and as a visiting professor at the United Nations Mandatory University for Peace in Costa Rica to teach a master's level course on gender in humanitarian action. Anu holds an MPhil degree in conflict management from the Nelson Mandela University in South Africa, a postgraduate certificate and a PhD in humanitarian affairs from the University of York in the UK. Anu has also studied psychology and is a life coach. Anu has a history of activist and academic engagement on violence against women in South Africa and presented the first study on intimate femicide at the 4th UN World Conference on Women in 1995 in Beijing. She has published numerous journal articles on gender, peace, and security, and is co-editor of the book, The Aftermath, Women in Post-Conflict Transformation, published in 2001 by Z Books, London. Welcome, Anu. The stage is yours.
Thank you, Arnab. I'm not sure why my video is not. Oh, here it is. Thank you for that. Whenever someone reads my CV, it always sounds so long and complicated, but I assure you it's not. I've been working in this field of violence against women for a long time, and I'm very happy to be here to share my thoughts and insights with you. Building on what Janaka spoke about in terms of interconnectedness, I'm going to talk to you about planetary health, well-being in the face of humanitarian crisis from a feminist perspective. Just to clarify, I am the co-lead of the Feminist Humanitarian Network, but I'm also the Global Protection Advisor for ActionAid. And I'm normally based in South Africa, but right now I'm talking to you from India, where I'm working for a little while. So next slide, please. So from a feminist perspective, all of what we've heard so far about planetary health and well-being, we want to really look at the intersectionality of gender, environmental issues, and social justice. So intersectionality is a really important point when we talk about a feminist perspective, because it recognizes the unique vulnerabilities of women and marginalized gender groups while advocating for equitable solutions that protect both people and the planet. I think here it's important to think of the term ecofeminism, because this is where we look at the oppression of women as well as the oppression of nature. And I think Janaka mentioned that in what he said. So intersectionality, it's important, the feminist perspective emphasizes the importance of intersectional thinking and, most importantly, inclusivity in all aspects of crisis response and recovery. And I'll talk more about inclusivity as we go along. Next slide, please. So just some key points to think about when we talk about interconnectedness and building on the interconnectedness that Dr. Jaya Vikrama spoke about. Environmental challenges, humanitarian emergencies, and gender dynamics are interconnected. And the key issues to think about is that we need to understand that environmental degradation, including climate change, exacerbates humanitarian crisis. So women and marginalized groups often bear a disproportionate burden of these crises due to pre-existing social and economic disparities. This is why it's important to bring in the feminist perspective. We also need to look at the fact that there are increased risks because humanitarian crisis and environmental degradation bring about displacement. It's a common factor, common phenomenon in these crises. And displaced women and girls face increased risks of gender-based violence, making it crucial to provide safe spaces and support for survivors. Access to resources is another important issue to analyze how environmental degradation affects access to essential resources like clean water and food. Women are often responsible for securing these resources, so their roles and responsibilities become even more challenging during crises. During environmental degradation issues and emergencies, we find that disruptions to healthcare are created, and inadequate healthcare infrastructure disproportionately affects women's health, particularly in terms of maternal and reproductive health care. Again, we need to look at livelihoods and the economic impact, because women are frequently engaged in agriculture and informal sectors, which can be severely impacted by environmental disasters. Loss of livelihoods can have long-lasting economic consequences for women and their families. This point, as women as agents of change, is a really critical one, because this is where we recognize the agency of women, but we also bring in a decolonial perspective in that inclusivity is not only about including women for representation, including marginalized groups, it's also about including wisdom. And I think Janaka mentioned that as well, about building on and going back into the ancient wisdoms and knowledge systems that we have discarded or been socialized to discard, as we have been so mainstreamed into the Western system of knowledge. And so inclusivity is also about looking at women as agents of change, as leaders with experience and wisdom, and being the experts on their own lives. Policy and advocacy is an important point to promote policies that address the intersection of these issues. So this may include gender responsive disaster management plans, climate adaptation strategies, and equitable resource allocation. At the moment, there is a lot of talk about cutting out the middleman in terms of the NGOs and going straight to the women's organizations at the ground level, who are always the frontline service providers and responders in a crisis. Data and research is another point where we need to ensure that research collects gender disaggregated data that's related to planetary health and humanitarian crisis. This data is essential for designing effective interventions that consider the unique needs of women and marginalized groups. We also need to ensure that women and girls, through education and training, are able to actively participate in decision-making processes. So this is where we can enhance their participation through education, empowerment, and training on climate resilience, disaster preparedness, and leadership. And lastly, the last point is on global solidarity. We need to recognize the global nature of these challenges and the importance of international cooperation and solidarity. We need to promote cross-border collaboration to address planetary health and humanitarian crisis from a feminist perspective. Next slide. So just building on that, the next slide, please. We're looking here at this, again, focusing on intersectionality, how planetary health, ecofeminism, and humanitarian crisis intersect. I won't go through all of this, but just to pick out that planetary health is focusing on the interdependence of human health. Ecofeminism, as I mentioned, explores the link between the oppression of women and the exploitation of nature, and it provides you with a critical lens to look at how patriarchal systems are contributing to environmental degradation and consequently to humanitarian crisis. And of course, we know that humanitarian crisis encompass a range of emergencies, natural disasters, conflict, and public health emergencies. Next slide. So in this intersection of planetary health, ecofeminism, and humanitarian crisis, it calls for us to adopt holistic approaches that recognize the intricate relationships between humans, the environment, and gender dynamics. It emphasizes the importance of sustainable gender equity and resilience in addressing the complex challenges posed by environmental and humanitarian issues. I'll stop there, and hopefully you'll be guided by your questions to deepen our discussion on this topic. Thank you.
Thank you very much, Anu.
I see that there's one last slide here. Let me just quickly say
yes,
that.
of course.
Sorry, I forgot about this one. This slide is just a how-to. We often, have all the theory of that we need intersectionality, we need to have a decolonial perspective, we need to work with people in a respectful way, in a bottom-up approach, but we often don't know how. And this is a model for how this can happen with inclusiveness, building authentic relationships, co-creating, co-design and implementation, and co-release, and always bearing in mind that there's a context. So even though you have to work on a micro level, there's always a macro level where the context needs to be taken into account, historical injustices, neoliberal capitalism, all the things that Janaka mentioned that is happening in the world around us. So I'll leave you with that. Thank you.
Thank you very much, Anu. A lot of interesting and important, very pertinent points you raised, particularly from the thinking about it from the feminist perspectives. But before we go to the question answer session, I'd like Maria to finish her talk for a bit before we go to the question answer session. So, and my request to the audience is, if you have any questions, please use the Q&A box under the screen to type in your questions, and we'll take those afterwards, after Maria speaks. All right.
Great.
Thank you.
Great. Thank you, Arnav. And apologies to all. Can you hear me now?
Yes. Yeah, we do.
Yes. I'm going to leave my video off, and I don't know if it is actually on because I'm using my phone. I don't know what happened to the Wi-Fi in general anyways. But sometimes these opportunities come, and this is these opportunities come, and this is great that Janaka and Anu has been able to speak on the well-being and really connect the dots from that perspective. Where I left off was actually on the how, so this makes perfect sense to continue from where Anu left. It's exactly on this co-design and co-creation and hopefully co-releasing together. The way we're approaching it with this planetary health framing in MSF is this the operational perspective of adapting our operations accordingly, so operational adaptation. The other being mitigation on really looking at our environmental footprint. And then the third being advocacy and speaking and bearing witness on behalf of those most vulnerable. On the first pillar, where what we do is actually looking at how best we can analyze the situation, taking in some of the intelligence and research and studies that's already existing, not to redo science, but actually to apply that science. How do we better assess and how do we better anticipate? Some of those actions that we've taken today is doing projects like the meteorological and climate anticipation project, linking that with the malaria anticipation initiative that really bridges the climate data with that of epidemiological data to predict where the disease burden would hit the most in any given time. It's also about partnering and working together and building more experience on the ground, like Health in Harmony, which is one of the true planetary health organizations, and we're collaborating with them in Madagascar as we speak, looking at the most vulnerable as the women and children, as Annie has said, and also specifically working with the community and seeing the patient and patient care in a more holistic manner, more person-centered, where patients are partners and co-designing projects accordingly that answers to their needs. This is what we need in the current planetary health situation that we're finding ourselves in. On the mitigation aspects, we're also collaborating with many who are looking at this and really trying to reduce our carbon footprint, which we made a commitment globally to reduce our carbon footprint by 50% by 2030 compared to our 2019 levels. We have our own climate smart team that carbon maps, but we are building these initiatives also with Healthcare Without Harm, Climate Action Accelerator, from projects like building hybrid project hospitals in Sierra Leone, for example, or working on behavioral change in South Sudan. The other is on building our knowledge and based on our direct experience and speaking to the health impacts that we are witnessing, giving voice to those most affected. We've contributed significantly in the last 6 years, in fact, on the Lancet Countdown, and this will be our 3rd year coming up on the COP28. And for the first time, there will be a Health and Relief, Recovery, and Peace Day, which is new. And so this initiative and this platform where we can actually raise awareness to what is really happening on the ground is critical in this large climate platforms. So then what is next? So as already been said by many of my co-panelists, it's this more connectedness that we need to do to give more visibility to the issue that we're seeing today, not only for tomorrow, and to find a collective nature-informed, nature-based solutions together. We need to walk that talk. We need to pay attention and we need to put it into action. If there's anything we should be learning in this recent emergencies, which is seen, COVID, Ukraine conflict, the repercussions of that, Yemen, Syria, Sudan, as I've spoken earlier, these are crises of alert. They're giving us warning and demonstrating the need for us to fix the system and have a hard look at what's ahead of us. Planetary health inherently highlights these failures of current systems across the board and how we need to fix this together. So regardless of how you formulate and look at these issues, whether it's just from the climate change lens and health, or the environmental health lens, or the eco-health lens, or the One Health, we need to band together and try to find that change for the greater good, because we have no choice. Just to close, so last week, before I came back to European soil, I was actually traveling in Asia, and I took a couple of days break in Bali, which is one of those places that I find the most healing for me, and I wanted to reconnect with nature. I went to see a shaman, and I had asked him if I was on the right path and what more I needed to do. He reminded me of our interconnectedness, of what we're talking about today, with our surrounding, our flora and fauna, and that all I had to do was be a good human. So let's all try to be that, and hopefully together we can find a better future. So thank you, everyone, and apologies again for the interruption.
Thank you, Maria. It's really excellent, like very pertinent points, and particularly about collaboration and going back to nature, like thinking about those things. It's like lots to take back from the talk today. So I see there are a few open questions here. So I'll start with the one that Fatima is asking to Dr. Anu. The how-to are important, as you mentioned. How much support is out there in getting to the how to, as bigger focus is usually on what to do? Anu, would you like to answer the question first? I see there are a few others that have already been answered in there.
So I tried to answer some questions by typing, but this one is a good question because I think it's really at the crux of everything. And I think Dr. Guevara, who just spoke now, mentioned it as well, you know, about how important it is to understand that how you are being is as important as to what you are doing. And I think there is a lot more support for the how to than there was before. And there is a lot more recognition that what you do and how you do it is really very critical. Knowing what to do is one thing, but knowing how to do it and how to be while you're doing it is really very critical, and brings in the whole question of the top down, bottom up thinking. You know, when if you're coming in as an expert and think that you know everything, you're already on the wrong foot, because you are not being respectful of the wisdom and the expertise that is already in the lives of people who are, you know, for whose lives are being affected, the affected populations that you're working with. So I think there is a lot more support these days. There are lots of courses and skills trainings and things on the how to, but I think that one needs to bear in mind that it needs to be built on humility, the qualities of humility, self-awareness, compassion, care. And I think, as Dr. Guevara said, being a good human being.
Yeah, thank you very much. So we do have a few more questions. I see one that Janaka has tried to answer, but would you like to explain that? Janaka, the definition of sustainable talk about intergenerational equality and inclusion. How can this be achieved with planetary health approach?
Okay, as I mentioned earlier as well, because without achieving the present day equality and inclusion, we won't be guaranteeing any equality or inclusion for future generations. They might not have any resources because we are destroying them. So when we talk about planetary health approach, as both Maria and Anu mentioned, that it's all inclusive, that we human beings become part of nature. We follow and respect the natural system, and in that process, or in that approach to planetary health, we can facilitate inclusivity and equality for the present generation. So that's how I would say it. Thank you.
Thank you, Janaka. So there are two direct questions for Maria. Would you like to
Yes.
take them, please?
Yes,
Can you share with us the difference between planetary health, global health, One Health, and environmental health? And the second one is, some of the communities and agencies may or may not see nature-based solution as solutions in tackling climate change. How do you see nature-based solution as a long-term solution for climate change that is acceptable for communities around Asia? Yeah, we can hear you.
Yeah, so first on the differences of the different disciplines. I mean, global health is the larger evolution from public health to international health to global health, where you have transnational impacts on the way you address healthcare systems, health policies, etc. So this is that new global health architecture that's risen because of our globalized world, with the rise of, for example, Global Fund and Clinton Foundation with HIV, kind of ushering in this era of global health because of our interconnectedness in that way. So planetary health is that much larger frame that covers all that. One Health was also a much more historical framing where in theory it was supposed to address human health with animal health as well as environmental health. But what has evolved in a more technical way is the connection mainly of two pillars of the animal health with human health. And it really focused a lot on the antimicrobial resistance and zoonotic diseases and emerging infectious diseases because of that interface between animals and humans, much less involvement in the environment. So that is where that's the difference between planetary health, which is also the three pillars, but more interlinked and more policy focused with a system kind of ecosystem perspective. Environmental health is obviously a very much of a focus on the environment itself. And so it's just finding whatever language you see yourself in and wherever, whatever discipline or intersections that you find yourself in, it's just a matter of linking and actually speaking it. So it's this action of connecting, and planetary health enables this kind of larger frame. And this is why I tend to go for that. As for the other question on, I saw one on funding, and I just wanted to answer that really quickly, if you don't mind, because it's very critical actually as we go into COP28, where loss and damage discussion and the funding mechanism around that is being discussed today. The development of the Santiago network, which is a technical arm, how to address this from that perspective. There's a lot of real pushback to ensure that these climate-based funds, climate-related funds or climate funding funds, are actually in addition to the humanitarian development funds, and that they actually help to fill gaps that are already existing. And as I showed you with Sudan, there's significant displacement. UNHCR is struggling to meet because their funding support systems is barely meeting a third of what they need today. So it is important to ensure that where there are funds, we use it in the right format. But probably one of the more important thing is that they actually get to the locals. There's one huge gap with the way current development or aid funding is today, is this middleman. It needs to go directly to those who are actors on the ground. The first responders are the community, and we need to find a way and how the funding and support goes directly locally. And then on, again, a reminder on the question regarding, can you remind me what was the other question on nature-based solutions?
Yes.
Yeah, so I think there's a lot of innovation in Asia today about how do we use nature. I don't think this has been connected to the humanitarian sector and how we can actually adapt this. This connection needs to be built upon. And I think this is where we could probably find the synergies, because what we should be looking for are the frugal technology, not the high technology, especially in some of this context that we're working in. And happy to really look further into how to bridge that divide into the future and actually incorporate more nature-related, nature-informed, nature-based solutions. And this is also one last thing on the community perspective. It's actually the people of the community who knows what those are. And I think if we were a more listening species and more integrative species, we would be able to listen to ideas outside the box than the frames that we've used historically in humanitarian aid.
Right. Thank you very much. We have one more open question I see here. I think I'm not sure who would like to answer this. It's basically Ishkandar. He's asking, can you all give some related planetary health to health tourism sector impact, like impact on health tourism sector, our planetary health after COVID-19? Would any of you like to take this question?
I'm not sure I understand actually the question, because some related planetary health. Is it a question around tourism and how planetary health policies impact that? Or,
yeah, I think similar.
okay.
Something. Yeah.
So, you know, in the wake of the COVID, there's significant discussions, obviously, of the pandemic preparedness and response as we go forward into pandemic, for future pandemic responses while COVID is still amongst us. It's really interesting because if we actually look at the existing platforms of the international health regulations and other initiatives that's been put forward before, part of the failure of these is because it's actually about protecting trade, protecting economy, and not so much addressing the health impacts and going where the needs of response need to be. And this is part of the challenge that we need to put back on the table. It's in that response. Yes, surveillance, and yes, monitoring, and yes, identifying future emerging infectious diseases. But it's also building capacities for response. And we know that COVID failed in the sense that the technology was sitting somewhere else where it needed to be. And so this kind of sharing and global solidarity, regardless of the great intention of the access to COVID tools accelerator initiative like the COVAX, etc., it failed because it was using the same framing and protecting my borders. So I think this is what we need to learn, right? It's if we can take the fear out and take the response and actually focus on the response, then maybe we could have a better global. It could help this knee-jerk reaction of closing borders and limiting our freedom. And when you actually have to do that to control the disease, etc., then it needs to be at least principle-based and rights-based. And we know we have experiences of that from other kind of emergencies, not so much public health emergencies like the Syracuse principles. So it's basically bringing up a principled approach to how we address any kind of emergency response or pandemic response in the future. I don't know if I answered it, but it's along those lines.
Yeah, thanks. We are almost to the end of our event, actually. Maybe one last quick one, if you would like to take this, anyone. What is your view on effectiveness of Asian parliamentarians for human rights on this topic? Anyone would like to take this up very quickly? Yeah.
Well, I think the ASEAN just really pushed their very ambitious program on how to be more green, as what I believe it just came out in the last weeks. It will be a challenge for the ASEAN community to meet that unless they do it collectively in solidarity together. And I think it's important that they actually support each of the nations of the ASEAN, because at least 5 of the countries are the most affected today of climate change, if not all of them. And it's much more to say around the ASEAN as a platform that it is. It has some very good intentions, but based on this very kind of it's still based on protecting resources and assets and protecting peace. So where is the right framing needs to come in on how do we better come from a collective principled approach, and yes, indeed, a more respect of the rights. It's a work in progress.
Yeah, right. Thank you very much. It's So I think before we wrap this up, we have this reflection cum feedback survey. So all the participants, if you could please to the feedback survey for us to just know more about how you have felt about this particular webinar and what we can do better in terms and what would you like to listen to more in the future. So thank you, everyone. And to wrap this up, I just want to thank Shanghai University, the Shanghai University, and the two research centers, including the Shanghai Center for Planetary Health and Research Center for Health and Wellbeing, to organize this webinar today. And we also hope to keep collaborating with Shanghai Planetary Health Center in the future and do further research and such collaborative webinars and conferences or seminars in the future as well. Thank you very much. Thank you for being here. It's really lovely to see so many people, so many participants for the webinar today. Thank you all. Have a good evening.
Thank you, everyone.
Thank you so much, Arnab, and all our amazing speakers for hosting this webinar. So if you go to menti.com, you can enter the code 28867152. That will bring you to the page. This would just like to go through a few questions to get a sense of how you felt about this webinar and also feedback for improvements for future events that we host. So the first question, we'd just like to know, what is your biggest takeaway from today's webinar? I think we can give people about 30 seconds to fill in your responses. Introduction to the term ecofeminism. Thank you very much. Okay, let's give it another last 5 seconds. Just submit your questions or your responses. Right, thank you for your feedback. Next, how would you rate today's webinar? Do you think the content discussed was understandable and relatable? You think the content was relevant to your career and interests? And do you feel the discussion kept you engaged throughout the session? Okay, we'll give people another 5 seconds. All right, thank you for your responses. The penultimate questions we have, what do you like most about this session? We want to keep it for future events that we host. Let's take 30 seconds as well. The Q&A. Yes, I love the discussion as well. Okay, we'll definitely make it a point to have open discussion and interactions with the speakers. Let's take 10 more seconds. All right, thank you very much. And the final question we have, what would you like to see in our next webinar series? Right, let's take 5 more seconds. Humanitarian. All right. Thank you very much. Gen Z speakers would be nice. I agree. All right, thank you so much, everyone. Thank you for completing the survey. I think Dr. Arnab has wrapped things up very aptly, we are really, really happy once again that we were able to make this webinar series happen. Thank you so much to all the speakers for taking the time to come and speak at this webinar. Thank you to everyone who has participated. We look forward to future collaboration with Shanghai University, with our various speakers, and with various other stakeholders in this industry. Thanks very much. We hope to see you at our future events.